Senator Irvin, you recognize.
Yeah, thank you. One of the ENT surgeons, and I appreciate those comments, but one of the ENT surgeons did voice their concern about liability issues with the pathology and on the episode. And so I was wondering if, are there any different regulations on Medicaid patients suing a doctor versus Medicare or private pay or anything like that?
Well, the short answer is no.
So there's potential for liability there if something got missed because we're following and trying to meet a threshold. There's liability. There's liability.
Absolutely. But I don't know of any ENT that would argue that 100% of the specimens need to go to the lab either.
Right. I understand.
It's a judgment call that they have to make with the training and experience that they have.
I understand that, but I think we just had a full discussion about liability and the concerns and how it affects the behavior too of physicians and how they react. So
You cannot underestimate it.
no, you can't, and I think that's valid. Bo, could you, under numbers again, 83 million lost on Medicaid patients. Is that annual?
Yes, it is annual.
And that's, okay, so that's hospitalizations, everything included.
Inpatient and outpatient combined.
Outpatient combined. So without the hospital assessment, which is on the back end, how long does that take? Is that annual?
That's an annual adjustment. We settle up annually. Yes.
Okay, so you're floating the money. You're basically floating the money other ways.
Well, it's a quarterly payment that comes to the hospital. So yes, it does. After the fiscal year starts, then they calculate it, and then in January or December they start paying payments. So yes, it does. It is floated along. Yes.
So you've got this range of costs that have to be covered by some other method of pay source. Is that correct?
That's correct.
So that's 47% would have to be covered by something else, correct?
That's correct.
Okay. And so there's no point you're 100% whole.
At no point.
So 82% once the assessment kicks in.
That's correct.
On Medicaid only.
That's correct.
Okay, thank you.